Hi everyone. In the last video, we talked about how even though anesthesia and comas look like the same thing, they're really not. If you haven't seen that one yet, I'll link it in the description below and you can check it out. Also, just so you know, there's only 4 more videos left in this series. After that, we'll get back to some of the more exciting video topics like how leprosy makes body parts fall off, what actually killed Neil Armstrong, the first man on the moon, and what were the final moments like for the people of Hiroshima, the Donner Party, and TWA Flight 800. So if you don't want to miss any of those, make sure to subscribe. Anyway, after learning what anesthesia does to the brain and that it's not the same thing as a coma, most people are relieved. But for some people, it just raises further questions, like if anesthesia interferes with memory and consciousness, does it leave any lasting damage? Could it cause memory loss? Could it accelerate dementia? Could it change how your brain works, like years after the surgery's over? Well, these are reasonable questions, especially if you or someone close to you is older or already worried about cognitive decline. The short answer is pretty reassuring, but there is some kind of correlation between surgery, anesthesia, and dementia. But the details really matter here, so let's get into it. The first thing to understand is that temporary confusion after surgery is pretty common, especially in older adults. This might look like trouble concentrating, slower thinking, feeling foggy, or just not feeling quite yourself after having an operation. This is either called postoperative cognitive dysfunction or postoperative delirium, depending on the situation and how long it lasts. But most importantly, it's almost always just temporary, and temporary symptoms don't mean permanent injury. But why does the brain even feel foggy after surgery in the first place? Well, anesthesia is only one piece of the puzzle. Surgery itself is a huge stress on the body. Inflammation increases, sleep is disrupted, pain medications affect alertness, and hospital environments can be unfamiliar and disorienting. All of these can affect how the brain functions in the short term. That's why it can be difficult to separate anesthesia from everything else happening around surgery. This is where looking at good quality evidence and data really matters. I'll put 5 links to evidence review summaries and patient studies in the description. They're too long and boring to talk about in depth here, but I'll summarize them quickly for you. 1. The British Alzheimer's Society has a patient-level evidence summary on their website. It says, quote, "There is currently no strong evidence to say that general anesthetics increase a person's risk of developing dementia." Number 2, a large cohort study published in The Lancet, which is a medical journal, concludes that short-term postoperative cognitive dysfunction with inhalation anesthetics does not represent long-term dementia risk. Number 3, a review article in the British Journal of Anesthesia says that postoperative cognitive changes are usually self-limiting and rarely persist in the longer term, although it does say that some plausible mechanisms do exist for it, so it needs further study. Number 4, another review summary from the Alzheimer's Drug Discovery Foundation, a nonprofit organization that provides funding to scientists conducting Alzheimer's drug research, says that evidence suggests anesthesia is not a primary factor in the long-term risk of dementia. And number 5, a review of evidence published in the Journal of the American Medical Association says, some studies show associations between surgery, anesthesia, and cognitive decline. But these are confounded by underlying disease, surgical stress, and patient vulnerability, not anesthesia alone. Again, I'll put the links to these sources in the description if you want to dig deeper into any of them. But together, they basically say that there's just no good evidence that anesthesia by itself causes permanent memory loss or dementia, and that people who do develop dementia after surgery almost always have other risk factors already present, like underlying health conditions or the stress of the surgery itself, not the anesthetic alone. Okay, with all that said, we still need to talk about why older patients may be a special case. Well, older brains are more sensitive to stress. That doesn't mean anesthesia is unsafe, but it does mean that recovery from surgery and anesthesia might look different. Older patients are more likely to experience some of that temporary confusion after surgery that we talked about, especially after major procedures. But that's why anesthetic plans are adjusted carefully for age, medical history, and baseline cognitive function. And it's also why family members are often encouraged to help reorient patients after surgery. We don't want you to have problems after surgery and have trouble remembering things. But if you don't tell us your concerns, then we can't change our anesthetic plans accordingly. So if you or a loved one have any qualms about receiving anesthesia for an upcoming procedure, I'm begging you to talk to your anesthesia provider about it. So bottom line, temporary brain fog after surgery is real, but permanent brain damage from anesthesia alone is not supported by strong evidence. Most people return to their baseline with time. And for those who are vulnerable, careful planning and support can make a big difference in how well and how quickly they recover. Knowing this helps replace vague fear with realistic expectations. Okay, so in this video we talked about postoperative cognitive dysfunction and possible long-term memory effects. But sometimes patients wake up extremely disoriented, sometimes even going full Hulk mode, kicking and screaming and ripping off their clothes and trying to pull IVs and catheters out. That's something called postoperative delirium, and it's what the next video is all about. If this video helped put long-term fears into perspective, the next one will help explain the immediate recovery phase. I'll see you there.